Elizabeth Elliott is a leading paediatrician from the Royal Australian College of Physicians. She accompanied the Human Rights Commissioner Gillian Triggs to Christmas Island, and she joins us now from Sydney. Elizabeth, good morning to you.
Morning.
You are a doctor, in fact a doctor of more than 30 years standing. What did you see on Christmas Island?
Well, look, I'm a paediatrician and I was asked up there not to examine the children but to observe the children and speak to the families. We spoke to nearly 200 families, and as you said, there are 174 children, mainly young children amongst them. These people are living in a tropical island in a remote location in very cramped conditions. And of course young children have recurrent infections, and we observed that. Many of the children were coughing, some of them had gastroenteritis, and there was evidently a virus. For example, the respiratory syncytial virus likely was circulating in the camp at the time that we were there. There of course were children with more chronic problems, such as children needing operations for their ears or for draining of an abscess, but most concerning were the mental health problems that we saw.
And how did those mental health problems evidence themselves?
Well, you'll be aware that there's a group of women with young children who are currently under surveillance because they have self-harmed. And of course that has a detrimental effect on children. Children pick up on that anxiety and that depression. But worryingly, we also saw children with signs of trauma and post-traumatic stress disorder. Children who'd started to have nightmares, who were having flashbacks, who'd started to wet their bed, started stuttering or lost their speech. We saw children who clearly said to us that that life was not worth living. I want to die, said one 12-year-old girl. My life here is death. We saw children, we heard of children who had self-harmed. We know that from the Immigration Department's figures, in fact, there are, I think, 178 children in detention centres throughout Australia who have self-harmed in about an 18-month period. So this really is an issue of concern.
You talked about cramped conditions there. What impact is that having on the children there, especially the young children, as they grow up?
Well, anyone who's had a toddler knows how difficult it is to contain a toddler and to be constantly holding a young infant. These people are living in very small rooms, perhaps 3 by 3 metres. They're metal rooms, so they have to be air-conditioned in the tropical climate. They have a single or a double bunk bed, and then if you have a baby, there's a cot beside that, a small fridge and a cupboard, which really doesn't leave any room to put a baby down. And that's one of the complaints that the parents have, that this really is stifling the normal exploratory behaviour in children who are learning to crawl and to walk.
Would you say, based on your observation there on that visit with Gillian Triggs, that most of those children on Christmas Island are sick in some form?
Many of the children were sick, and yes, almost everyone we saw seemed to have a cough at the time. Of course, some of the children have acute infections and some of them have asthma. We know that asthma is precipitated by acute viral infections and also precipitated by, for example, cold air. And these children are living in an air-conditioned environment. As I said previously, when you're living in very overcrowded conditions, it's not surprising that these infections spread very rapidly. And as I also said, there were other children with other concerns, problems with their hearing, problems with the development of speech, medical problems that needed surgical attention. And of course those children require transfer to the mainland for specialist care.
Scott Morrison on 7:30 last night, you may have seen or heard, described claims of widespread illness, mental health problems as sensational. He also said that those children are getting appropriate medical care. Based on what you saw, are they getting appropriate medical care?
Well, there is medical care on the island and the people there are doing a good job in providing that care. But of course, as I said, you can't provide specialist care when you don't have specialists on site full time. So for example, when there are a lot of people self-harming, it would seem that there needed to be a psychiatrist there full time, or that those people better were transferred out of the stressful environment and back to the mainland.